It is an honor and a pleasure for me to talk with you here at the beautiful Wisconsin Dells and to participate in your annual conference on Alzheimer's and related dementias. You know most than more how awful it is to be an Alzheimer's patient. You know the personal cost and the impact on our society. You have taken this cause to your heart, and I thank you. You may not know that we spend $2.50 on Alzheimer's care for every penny that we spend on research, and that 1/3 of the population will have Alzheimer's by the time they are 58. What I want to do today is tell you what I think we need to do about this problem. But before I do that, I would like to tell you a little bit about my own personal story. I grew up in Nevada in an education-oriented family. Both of my parents were school teachers. I was fortunate enough to be one of 2 presidential scholars from the state of Nevada, while at the same time being on the university gymnastic team. I got my bachelor's and my PhD in chemistry before moving on to the then exciting field of molecular biology. I worked as a postdoctoral fellow at the University of San Francisco. I then left academia and became one of the first 6 employees at what was then a risky new biotech company called Chiron. I had a remarkably successful career working on developing vaccines for hepatitis and herpes. We took the herpes vaccine through phase 3 clinical trials and conducted trials with HIV as well. Because of the breadth of my vaccine experience, I was able to leave Chiron and to start my own consulting company. When the biotech company, Elan, had the idea of using a vaccine approach to treat Alzheimer's disease, they hired me as a consultant. My last job was as a director of a laboratory within the Stanford Research Institute, now called SRI. I ran a large, successful, and well-funded group that looked for novel therapies for infectious diseases. I was 59 years old. I loved my work, and I anticipated a long career. And then the sky fell in. One day, one of my lieutenants came to me and asked, "Why are you making so many mistakes when you used to be so meticulous?" A single trip to the neurologist revealed that I had early onset Alzheimer's, effectively ending my career. I enrolled in a clinical trial of a vaccine. Ironically, it was the vaccine that I had worked on several years ago at Elan. That was 5 years ago. What's life like for me now? I cannot remember dates and times. I have trouble keeping track of a calendar. Remembering streets is difficult. I can no longer drive a car. Handling a TV remote is difficult, and handling finances is impossible. One of my weekly highlights is meeting with a group of friends who also have early onset Alzheimer's. The hard reality of this disease was just revealed to our group with the loss of one of our dear colleagues. One of my major goals is to increase awareness and funding for research of Alzheimer's disease. We should look where other groups have accomplished this very effectively, for example, HIV/AIDS. Biomedical scientists like myself are proud of the fact that HIV is nowhere near the scourge that it once was. Medicines are available, and life expectancies are remarkably improved. What led to the successes for HIV? It was simply advocacy. People with the disease and those who loved them pressured everyone with enormous passion and energy. They pressured the government, the researchers, the pharmaceutical firms, the FDA, and even the entertainment industry. With what a result? A vast stream of dollars and creativity that went into the therapies that are available today. I am sure that everyone in this room believes that Alzheimer's is at least as big a problem as HIV/AIDS. Yet it is funded and researched at a much lower level. We must learn from their example. We must do a better job of advocacy. We all know the reasons why it is so hard to be an advocate for Alzheimer's. It is seen as a disease of the old, and young people never see themselves as getting old. People who have the disease often lack the mental capability to be articulate advocates. Alzheimer patients are often embarrassed to admit publicly that they have the disease, or may even be in denial. So here's a shout out to the Alzheimer's Association. Think of those who have early onset Alzheimer's as your obvious advocates. We are the poster children for this insidious disease, and you need to use us. We are young, we are tragic, and we are energetic. And there is something more. Advocating for equitable funding for Alzheimer's research and even participating in clinical trials gives meaning back to my life. In addition, I can recommend these simple things for other early onset Alzheimer's patients. Walking with friends, and going to museums, getting to know your community on a first name basis, the grocer, the pharmacist, the ladies at the salon for and the dry cleaners, as well as the cafe crew. Join an early onset group. In my group, we feel empowered by the idea of coming out of the closet and announcing to the world what has been taken from us, and demanding our fair share of research dollars. I would like to thank the Alzheimer's Association for inviting me to this conference, and I thank you for taking the time to listen to me speak. Given talks across the country, but today is a unique opportunity. And I would like to introduce my daughter, Dylan, who is going to share the platform with me and give you some insight about her experience and what this disease means to her.
Hi everyone, I'm Dylan, and this amazing person is my mom. Like my mom mentioned, she was diagnosed with Alzheimer's almost 5 years ago. My great aunt, for whom I'm named, died 4 years ago of Alzheimer's. And my great grandmother died when I was 3 years old, also with the disease. There's a distinct possibility that I might get it, On bad days, I'm pretty convinced I already have it. We are definitely a family impacted by Alzheimer's. So how has it changed my life? Well, first let me share some of my story. So 2 years before my mom was diagnosed, I started thinking that something was different. I noticed that she had started misspelling words. It was a subtle change, but a huge red flag. See, my mom has always been exceptionally intelligent. She always knows how to spell words. She has impeccable grammar. To this day, she still corrects my grammar. It's embarrassing, I'm 30 years old. Thank you. As it turns out, that intelligence has been a blessing. Her neurologist told us that we were lucky she had such a high-functioning brain because she could have Alzheimer's for years and end up with an average IQ. Anyone who has known my mom would describe her first as intelligent and second as successful. In her career in science, she was involved in the development of important vaccines like hepatitis and therapeutics like factor VIII, a blood-clotting agent for hemophiliacs. As you've heard, she was involved in the development of the Alzheimer's drug bapineuzumab, the one that was making headlines last year as we all thought it might be the next big breakthrough. By the time that my mom had the disease, bapineuzumab was beginning human trials, and so she was enrolled in the trial for her own drug. As it turns out, I would occasionally go with her to those appointments, and she would slip right back into work mode, talking to the doctors and saying words I didn't even understand, like monoclonal antibody. I don't know what that is. She knew more about the drug that she was taking than the doctors who were administering it. So 2 years before she was diagnosed, I knew something was changing. And the first time I mentioned my concerns to her, she said matter-of-factly, in typical Dr. Burke style, "Yes, I've noticed the same thing. I've looked at the literature, and I've either got Alzheimer's or Lyme's disease." My mom didn't want to go see a doctor because she knew exactly what was happening. Finally, we went to an appointment together at the Center for Memory and Aging, and in that appointment, they confirmed our worst fears. My mom had Alzheimer's. The floor fell out from under me, and ever since that day, it's been a process of getting back on my feet, only to be rocked again each time my mom progresses to another stage of the disease. My heart has ached as I've watched my mom begin to struggle with reading her watch, then using her phone, then buckling her seatbelt. At each stage, what hurts most is watching her struggle to maintain her independence and dignity. And to watch somebody who's built her identity on the brilliance of her brain, to watch her slowly lose that identity. The emotional roller coaster of Alzheimer's is never to be underestimated. But the disease doesn't hit all families equally. Some families have the financial resources to cushion them from the blow, while others are quite literally bankrupted. Some families have the ability to pay for care facilities where their loved one will be well taken care of. And if they're still at home, they can pay for in-home care. They have great health care with access to the best doctors and the latest research. On the flip side, we all know that the vast majority of families really struggle financially to care for their loved one with Alzheimer's. And the problem is that they're mostly alone in that task. Children leave their careers in order to stay home and care for their parents. And then 5, 10 years later, they really struggle to re-enter the workforce. And then they're left without health care and without a pension, and also facing the greater genetic likelihood of developing the disease. Alzheimer's is a lens through which we can view the inequalities of their system play out, and it hits families with fewer financial resources the hardest. It is unconscionable that we as a society have people with this disease who also don't have housing or health care or access to a care facility where they will be treated like they're someone's cherished parent. But all of this speaks to a larger issue. See, I definitely echo my mom's call for more funding for research. Lord knows, for my own future, I want there to be a cure. And even if there were a cure, another disease would come and take its place, and families would still be struggling. From my perspective, and I imagine that many of us in this room agree, what we need is both a cure and a more fundamental shift in the way that we care for each other, both individually and as a society. One of the values that my family has instilled in me is a fierce independence. They have always supported we kids to be independent, to be self-sufficient. We, like many people in our society, were encouraged to dream big, to follow our career, and to prioritize living our own lives. Because of that, I was living as far away as Nicaragua when I first noticed that my mom was struggling with spelling. So where does caring for a parent or caring for our community fit into this paradigm of independence that we so pride ourselves on? As my mom's disease progressed, I decided to move home and to prioritize being near my family and showing up for my mom when she needs me. One of the beautiful things that has come out of my mom having Alzheimer's is that I've shifted some of the ways that I think, from a fierce independence to valuing interdependence and showing up to be with my family when we're struggling. I think that as a society, we need to revalue the importance of taking care of one another, both as families and as communities. My mom mentioned how important her early onset support group is to her, and I think that that speaks to the key role that community support plays in all of our lives. She told me one day that she really struggles at this point to know what day it is. But her support group happens on Thursdays. So she explained to me that when she wakes up in the morning, she asks herself, what day is it? Well, if she's going to the support group, it's Thursday. And if she's not going to the support group, then it's just not Thursday. But even if my mom doesn't know what day of the week it is, we both know that today is a big day. Both my mom and I struggled with a lot of denial after getting the diagnosis. My mom wouldn't tell anybody in her life for a long time, and for years I avoided anything that had the word Alzheimer's attached to it. But today, here we are, in front of all of you, sharing our story. Thank you for this opportunity.